Hello, my name is Christine Ng. I am a nursing student. Today we will be learning about diabetes mellitus. Learning objectives are learn the pathophysiology of type 1 and type 2 diabetes, learn the etiology of diabetes, learn the clinical manifestations of type 1 and type 2 diabetes, learn the signs and symptoms of hypoglycemia and hyperglycemia, learn how diabetes is diagnosed, learn how to identify healthy food choices to manage diabetes, learn how to check your blood glucose daily, and learn the importance of insulin. So there are two types of diabetes. There's type 1, also known as insulin-dependent diabetes. It's an autoimmune disorder that when antibodies destroy insulin and our pancreatic beta cells that produce insulin, the body is unable to produce enough insulin for the person to survive. The clinical manifestations usually begin to show up when the pancreas are no longer able to produce enough insulin to maintain normal levels of glucose. It's usually diagnosed at a young age and more common in young people. Main common causes are genetics and viruses. About 5 to 10% of the population, of the diabetes population, are diagnosed with type 1. And the onset of symptoms are very rapid. Type 2 diabetes is a combination of inadequate insulin secretion and insulin resistance. This one is also known as non-insulin dependent. It's when the pancreas develops insulin resistance. It makes some self-made or endogenous insulin, unlike type 1 diabetes. There are mainly 4 factors that contribute to the development of type 1 diabetes. One is insulin resistance. The ability of the pancreas to make insulin is decreased. Inappropriate glucose production by the liver. Modified production of hormones and cytokines by adipose tissue. And the main causes are usually obesity or genetics. Onset is gradual. It can go undetected for many years. Like a person can have it for about 6 years and not know that they even have type 2 diabetes. Clinical manifestations. So they're different, but same in a way. Type 1, polydipsia, polyuria, polyphagia, fatigue, weight loss without trying. For type 2, there's usually often not any clinical manifestations. Like I said before, it takes a while. It can go undiagnosed for a while. So fatigue, recurrent infections, polyuria, polydipsia, and polyphagia. So diabetes is usually diagnosed with an A1C blood test. If it's 6.5% or higher, it's usually you're usually diabetic. They do a fasting plasma glucose. If it's 126 or higher, a 2-hour plasma glucose level of 200 or greater during an oral glucose tolerance test. And with a patient who is in hyperglycemic episode, a random plasma glucose level of 200 or greater. Hypoglycemia symptoms. Usually confusion, they're really disoriented, they're not able to concentrate, they feel dizzy, really hungry, irritable, sometimes loss of consciousness. Sometimes they can go in a coma if not treated immediately. Sweating or nervousness, really fatigue. Hyperglycemia symptoms. Increased urination, vomiting, fatigue, same. Slow wound healing, increased infections, increased thirst, blurred vision, increased appetite, unintentional weight loss, nausea, they can go into coma, or diabetic ketoacidosis. With diabetic ketoacidosis, is usually your blood sugar is over 400. I think it's 400 to 500. It's over that. It can go even as high as 700. And it usually have a fruity breath, is what they call it. And then how to check your blood sugar. So normal blood glucose is 70 to 140, and they have these little glucometers. They're usually prescribed to you by a provider. So for step 1, you gather all your materials, of course. The glucometer, the test strips, the lancing device or a needle, alcohol wipe, and then a cotton swab if needed. So wash your hands. And then step 3 is prepare the lancing device with a new lancet. Depending on how your blood flow is to your fingers, you might have to go a little deeper with a needle. So with the lancet device, that's adjustable. And then prepare the glucometer with a test strip. And then cleanse the pointed finger, so whichever finger that you would prefer, with an alcohol wipe, and then allow it to dry. Then prick the finger with the lancing device. Then apply a small drop of it at the tip of the test strip, and results will usually reveal in a few seconds. And then dispose of the lancet. Drug therapy, it can either be oral, it can be managed orally, just oral medications like pills, or by insulin. More common for insulin are like Lispro, which is like a short-acting, or they call it a bolus insulin. And then there's also a long-acting one called Basaglar, or also known as long or intermediate acting. And that one lasts for usually a pretty long time, and we'll talk about that in the next slide. Common pills that are usually prescribed and managed with is metformin, glimepiride, glipizide, Nicena, bromocriptine. Then insulin. So there are 3 different types of insulin. There's rapid acting, intermediate acting, and slow or long acting. And the onsets and peaks and the durations of it are all different. And they're named right there at on the table. Insulin is hormones made in the pancreas that allow your body to use glucose for energy. It contributes in balancing blood glucose levels when there is too much glucose in the blood. People with diabetes may require exogenous insulin in order to meet metabolic needs. Exogenous insulin would mean the injectable insulin. So 2 or 3 types of insulin. Usually the long or intermediate, they put it into one type. So rapid acting usually is like Lispro, Aspart, and the onset is 10 to 15 minutes. That's usually given like 30 minutes before a meal. Intermediate or slow or long acting is usually giving either once a day or twice a day to last about up to 18 to 24 hours. How to manage diabetes. Maintain a healthy diet, create an exercise plan, be active, be coherent with your medications, check your feet daily for cuts, blisters, and swelling. Patients with diabetes, they're more prone to infections, and they have a very slow healing process. So it's really important that as soon as you see a blister or a cut, you treat it right away, properly, just like I said, because they do have a slow healing process. Maintain oral hygiene, quit smoking, and then check your blood glucose daily or more times a day, whatever your provider will prescribe. Healthy diabetic diet. So there's a little thing called the follow the plate method, where half of the plate is non-starchy vegetables, a quarter of it is lean protein, and a quarter of it is carb foods. You usually want to take a low-calorie or a zero-calorie drink or water. Recommendable is to plan your meals daily to fit your healthy needs. Eat small portions throughout the day, and limit your sodium intake. Limit your alcohol intake. Alcohol is really high in sugar and it can cause your blood glucose to increase really high. Eat a variety of whole grain foods, vegetables, and fruit. Maintain a low sugar and carbohydrate diet. And then there's a post-test to be taken after this. And thank you.